All right, we are live starting now.
Hey, how are you?
Okay, so we have Laurie Powers here on the live interview, sleep apnea specialist, fellow PA, right? That's right. So, Laurie, I'll also mention, and once we start, I always mention that people who are watching, when they comment, we may be able to see their comments, but they may not be able to see other people's comments because this is broadcasting on different platforms. But if there's any questions as people are joining in, of course, I'll screen them and watch them and watch out for that. Okay, and then so the topic right here is how to get great sleep. Right, it's something we all need very badly. I mean, because a big part of our living is
Exactly.
sleep. Something that if you're alive, you need to do frequently. Um, but it's funny though, Laurie, that we live in a very fast-paced society, and I think this is a good topic because, man, I'd say that the vast majority of people are not getting restorative sleep, right?
Right.
So this is a very good, important topic. To start off, can you let us know your background, your experience in education?
Sure. So I went to PA school at Duke in 1988. So I've been a PA for 34 years. So it's a really long time to be a PA.
Mhm.
We were just talking, and I've just taken my seventh PA board exam, which is a really big deal. I think I might be the oldest PA in the world. I'm not certified.
Well, let them know how often we got to certify. If you're brave enough to give people hints on how.
Yeah, every 5 to 6 years is what it used to be until recently. Now it's every 10 years. But that's why I've had to take so many
Yeah.
exams because of that. So I'm a primary care PA. I graduated from Duke in 1990, and I have actually had several different types of jobs as a PA, everything from hematology, oncology, ENT, urgent care, family practice / internal medicine. But most of my years I spent practicing psychiatry, actually,
Mhm.
child, young adult, and I would keep my children, so sometimes middle-aged adult, depending on how long I'd
Really?
been seeing them. Yeah, I had a few parents, and I, later saw them as children, or vice versa. Like
Yeah,
a whole generation.
yeah.
So that's kind of what happened with me as a PA. I wound up getting certified in psychiatry too. So I do also have a certification in psychiatry. Then about 7 or 8 years ago, before COVID, yay, I went back to school and studied culinary medicine, which is the art of preventing and treating disease using food. That's a 2-year certification, and that program was at Tulane University. And we flew back and forth, and I took cooking classes with culinary medicine specialists who were also doctors and learned how to treat disease using food. So that was probably my favorite time of my life. That was very life altering for me. And I was using food to treat my psychiatric patients, and depression and anxiety and focus were getting better. But the one missing link was sleep. There was no magic food that helped my patients sleep. And my goal in life was to get patients off medication and prevent medication, but I couldn't do that with food and sleep. And so I heard about cognitive behavioral therapy for insomnia while I was working at a sleep lab. And I thought, I definitely need to check that out. So this was over COVID now, so I had to go virtually, but I went and got trained in cognitive behavioral therapy for insomnia, which means I basically became a sleep therapist. And with that training, I learned how to screen for sleep apnea,
Mhm.
test for sleep apnea, treat sleep apnea, test for narcolepsy, and also, of course, teach people to sleep. That's what cognitive behavioral therapy for insomnia is.
Yes.
It's generally a 4 or 6 session, basically education on how to sleep.
Sleep
So it
better.
doesn't just include sleep hygiene, which are the obvious things. For example, not having caffeine within a certain number of hours of bed. There's actually some therapy to it. And since I'd done psychiatry for so long, it really fit in my wheelhouse.
Yes.
So that's kind of who I am. But of course, that involved another board exam. So here we go. So I think I've had 79, 10. I think I've had 10 board exams in 34 years.
So well educated, well experienced on this topic. Great, good job. So last time we had an interview, we talked about diet a lot. I definitely want to get more into the cognitive behavioral therapy portion because a lot of people I think can benefit from from whether or not they have sleep apnea, but
Mhm.
what they learn to get better sleep. So again, those who are joining in, if you have questions for Miss Laurie Powers, she is the one to ask if you want to get better sleep. One thing I also ask, if anyone would like to let us know where they're watching from, their name, I always like to greet them. So remember, we always do that in the beginning. Okay, first question, how important it is sleep, especially like I said before, we pride ourselves in overworking and being exhausted, right? I'll go to sleep when I die is the saying, right?
Right, right.
How
Most Americans are sleep deprived, and what's really sad is it goes all the way back to our children. So since my background is actually child and adolescent psychiatry, I see age 2 and up. So you can't do cognitive behavioral therapy in a child. Their brain is not developed enough, but I do behavioral therapy, pediatric insomnia for children. So I still work with even the little ones and teach them how to sleep. But the vast majority of us are completely sleep deficient. And part of it is our own fault, right? We want to game. We want to have screen time. We want to stay up late to do our chores because we worked and we have kids and we need to get the laundry done. Part of it is our own fault. Sometimes it has to do with pharmacology, so side effects of medications that we're taking. Sometimes it has to do with mental health, right? Anxiety, especially. I see a lot of anxiety and insomnia. Some of it is lack of exercise. So there's a whole host of things, but I take a really detailed medication, psychological history, and then I take a detailed sleep history, and we try to put all the pieces together. I screen them for insomnia, I screen them for narcolepsy, and I screen them for sleep apnea. And I order whatever tests are necessary. So if they need a test for sleep apnea, we order that. Sometimes I think it's physiological. In other words, maybe they have vitamin D deficiency, maybe they have B12 or magnesium deficiency or a thyroid problem, or in menstruating women, iron deficiency. All these things can cause restless leg or insomnia. So some of it involves lab work. So I kind of think of myself as almost being an investigator, like trying to figure out all the pieces of the puzzle. And I tell my patients that all the time. I love sleep medicine because it's all fixable, but we have to find all the pieces of the puzzle. If we only find one piece, like sleep apnea, and I give you a machine for sleep apnea, it only fixes breathing because sleep apnea is a breathing problem. It's not a sleeping problem. In order to get good sleep, you have to be able to breathe, right? But you can breathe and still get junky sleep. So we have to take all the questions into account and find all the parts of the missing puzzle and fix them. And they are all fixable.
So there can be multiple causes, reasons. You're investigating and narrowing down what problem a person has that's causing them to have poor sleep. So
it's almost always multiple. It's kind of like ADHD. ADHD doesn't usually exist by itself. There's usually more than one problem with ADHD. And just from being in psychiatry for so long, sleep apnea or insomnia is much the same way. There's going to be multiple things and we have to fix them all. And I love that. I love complicated patients and finding all the things and fixing them and then like they sleep.
That's why it takes. I remember you said on our first talk together, it took like your first session is like 2 hours long, right?
Yeah. Well, it's partially my fault. I just like to talk. But yeah, my intakes are like 2 hours. And my follow-ups, I try to keep them at an hour. But it's because I delve. I really need to know the person. I need to know what their bedroom looks like. I need to know what their life looks like during the day. How much time are they outside? How much time are they getting for exercise? What is their partner like? Does their partner snore? Do they have pets? Do they have a kid in the house with insulin-dependent diabetes with an alarm going off? Have they had trauma? So they're anxious at night. Like I had a young lady today who can't sleep because she sleeps with weapons in her room because she has a history of trauma. So I have to delve into all that to fix a sleep problem. And sometimes I have to get other professionals involved, because I'm not doing the psychiatry anymore. So sometimes we need to get, some support, right?
Yeah, absolutely. So why should we take it serious? So, okay, we know what's causing the problem, that it is a problem. Let's scare people now. Okay. So, let's get people to get serious about sleep. Why should I care that I don't get 4 or 5 hours of sleep?
Well, there's a few reasons. Well, let's just talk about sleep apnea by itself. Sleep apnea untreated by itself can kill you. I mean, you can have sudden death because your heart enlarges and, there's all kinds of cardiac and other problems that can happen from untreated sleep apnea. So that alone is a reason to talk to a sleep specialist if you're having sleep problems. Okay. But as far as insomnia can kill you too. Over time, insomnia is horrible for every part of your body, your brain, your physical body, but also your gut health. And so a lot of what I do, and probably a lot of what you do as well, is gut health. If your gut health is not well, you're not a physically healthy person, and you're at risk for all the chronic medical problems, which can kill you, right? So heart disease and diabetes and all those things. So I tell people, if you want to be your best physically and psychologically, and you want to prevent disease, then you have to sleep well. And that's why it was worth an extra few years going back to school and getting another certification, because I wanted to add that to my practice. And most doctors have no training in how to teach people to sleep, just like they don't have nutrition training usually.
Exactly. But you got both. Right?
Yeah. So that's why, so now I just kind of considered me like lifestyle medicine, wellness, kind of next to your primary care and next to your psychiatrist, but I'm not trying to take their place because I won't prescribe anymore. So I'm not a prescriber. I don't want to be. So I can't take their place, but I work with them as long as they need me. And I've had some patients that see me every month now, and it's been 2 years. And other patients I see 4 times for sleep, and they're done and they're out of there. So it just depends on what you need. If you're trying to lose 200 pounds or whatever, you need to see me longer than, somebody that just can't sleep.
Okay. So, there's a difference between insomnia and sleep apnea. And we're going to go into, for those who are watching, don't worry, we're going to give you solutions. We're going to talk about treatments, things you can do, practical. What is the diagnose? How do you diagnose somebody with sleep apnea specifically? Because there's a lot of people who might have sleep apnea and don't know it.
Right.
Address that. Yeah.
So the last time we talked, I know we talked about a quick screening tool that any doctor can use. So if you go to your primary care doctor, I see people talking in here. Am I supposed to read this, or are you doing that?
Oh, no, yeah, I'll keep an eye on the chat. Yeah.
Okay, I won't pay attention to it. There are 7 questions that are on. It's an acronym, so it's called Stopbang. So there's questions on there that you could read to yourself, or your doctor could do it in the office. And if you test positive, and I can tell you what positive or negative is, then you need to be tested for sleep apnea, most likely.
Which is a sleep test, right?
Yeah. When I ask the questions are pretty much yeses or nos or short answers, and then I delve into it. And once I get that information, I'm almost always right. Like I just, most of the time, I think I've had 1 or 2 patients that I was like, really? I really was sure you didn't have that, or you did have that. But almost always I'm right, because the symptoms speak for themselves. So Stopbang, again, it's an acronym. So the number 1 thing is snoring, but you can have sleep apnea and not snore. Okay. Now the snoring needs to be moderate in intensity, and it needs to be consistent. So if you just snore when you have a cold, I'm not usually worried about that, right? Okay. I mean, there's a reason for that. You have nasal congestion. But if you're snoring on a regular basis, that could be a problem. So moderate snoring means that if you and I shared a hotel room together, I could hear it from the other side of the room. Okay. So if only your bed partner hears it, that could be mild snoring. But if somebody walks you to the bedroom and can hear it without getting in the bed with you, that's moderate. If they can hear it outside the door, that's severe. So that's a way. And sometimes I have to have patients say, think about when you've gone to a conference with a coworker. Think about in the military, when you're in the field. Think about when you go home for Thanksgiving and you stay in your parents' house. Like, who hears your snoring? So that's question number 1. Yeah. And the other problem with that is sometimes the partner is a very heavy sleeper. So maybe it is moderate snoring, but they can't tell you because they're dead to the world at night, right? Yeah. So that's the S part. T is tired. And that's just, that's a very subjective thing. So I usually say on a 0 to 10 scale, if 0 is, I don't want to get off the couch, even if it's my favorite activity. And 10 is, I could go mow grass and go do all my favorite activities. Where's your energy level on the average day?
Okay.
And everybody's energy level should be 7, 8, 9, or 10. If it's lower than that, that's a problem. Okay. So that's how I score that. And then O is observed apneas, meaning, has anybody ever seen you pause or stop breathing at night? It could be any type of bed partner. It could be your child. It could be your coworker. It could be an anesthesiologist. So if you've recently had any type of anesthesia, you could ask them if they've ever seen that. So, but if anybody's ever seen it, then that counts. Okay. So that's the first 3. P stands for pressure. Okay, so that we're talking about high blood pressure. So if you have a diagnosis of high blood pressure or your blood pressure is consistently elevated, I'll ask them what the numbers run. And nobody's actually documented that yet. That would count.
Yeah.
And then the other parts are B is for BMI. So if you're class 2 obese, which is a BMI for an adult is greater than 35. Okay, but even being overweight or class 1 obese puts you at risk. But in order to score high on the Stopbang, you need to be class 2 obese.
Okay.
The next one is age, which is over 50. That's when the risk factor really goes up.
50.
Okay? Then neck size. So I actually have a tape measure. Okay. Yeah. So for men, if your neck is 17 or larger, and for women, if it's 16 or larger. And when I do telehealth, I tell people, go get a tape measure. If you don't have one, get an iPhone cord and put it around your neck and find a ruler, a yardstick, whatever you've got. Yeah, we try to get that. And then the last one, Stopbang, the last one is gender, which stands for male. Men have twice the risk. Now, these are all for adults. For kids, and I know we're not here to talk about kids. For kids, it's different. They don't really have a Stopbang per se. But if they have any type of disordered breathing as a child and any kind of snoring problems, then they get tested, especially if they're overweight, obese, especially if they have bedwetting at certain ages.
Yeah.
So kids have kind of their own scale, but right now I'm talking about adults.
We could probably cover live for kids specifically, I think, right?
Say that one more time.
I was saying we could probably do a live another time.
Yeah, we could do a separate one for kids because it's completely different. So if you're thinking about your child, obviously these are meant for more for adults. The kids have different symptoms. Now, if you score 3 or higher on this Stopbang, then likely you need to be tested for sleep apnea. Okay. Okay, and you can see how easy that would be because if you're a 50-year-old man, you already got 2 of them.
Yeah. And I'll post it in the chat so anyone sees. So just the acronym at least, Stopbang, STOP, Stopbang. You can even go online for the questionnaire. A lot of times you can Google that questionnaire, 3 or more on the Stopbang, and you're
considered intermediate risk. And what that means is your insurance companies will pay for it. So, and that's what people are really looking for. But even if they won't pay for it, it's only a few $100s to have a home sleep test.
Yeah.
So, my patients that don't have insurance, if they need it, I'll just get a home sleep test for them.
Yeah.
Yes, you can get rid of sleep apnea in some cases. I just saw that question pop across the screen.
Yeah. All right. Before we address the question, I just also want to acknowledge Becky and anyone else who's watching. Let's see that I might have missed, but Becky, thanks for watching. You're from Maryland. She says she sleeps with the radio on at night.
Right. We'll talk about that in a second.
Talk about that. Then we have a comment from T. How do you help Tebow? How do you help a child or an adult even to sleep without their mouth open? I'm aware this can cause significant issues to the body in the long run. So we have that question, and then
so lots of them.
Okay,
I can see the question, so that's awesome. So we'll start with getting rid of sleep apnea. The only way you can get rid of sleep apnea is if it's obstruction because of your weight. So I've had people reverse sleep apnea even by losing 10 pounds. So if you're a perfect body mass index, then likely it's anatomical and weight loss isn't going to help you. But if you have weight to lose, then there's a good chance that you can get rid of sleep apnea. But the only way to know for sure is to lose the weight and then get retested.
So if it's anatomical, is a good point. That's something that probably has to do with the structure of jaw and throat, right?
Right.
Yeah.
So sometimes there's a surgery that can be done though. So for example, and it doesn't usually happen for adults, but children will get large tonsils and adenoids, but sometimes adults can as well. Or you could have a very large uvula, which is that little guy that hangs down in the back of your throat. So sometimes they actually remove the uvula or part of your soft palate. But if you ask your family members and everybody has it and none of those things need to be fixed and you haven't, for example, broken your nose and it needs to be straightened, or you don't have polyps in your nose and in your sinuses or large turbinates in your nose, if there's nothing that an ENT doctor can't fix and you don't need to lose weight, then it's the draw of the cards, probably genetics, or that's just how your body is made and we can't fix it then. So but there are multiple, I'm sorry?
I was going to summarize. Lose weight. If that doesn't work, probably need to see ear, nose, throat specialist.
Yeah, or maybe allergist. If there's a lot of nasal congestion, you could try an over-the-counter Flonase nasal spray and see if that doesn't help. And one thing I always tell my patients, especially if they're waiting for their sleep test, is don't sleep on your back. Now, most snoring and most sleep apnea happens on your back. So how do you avoid sleeping on the back? I'm so old that we used to actually make sleep apnea shirts in ear, nose, and throat clinic that I used to work in by sewing tennis balls to the back of a t-shirt and putting it right here. Okay. Because then if you try to roll, you'll feel the tennis ball, and you can actually do that. They're soft. Put the shirt inside out, take a needle and thread, put an X there and sew it, a nice tight shirt so it doesn't move around. But now Amazon, woohoo! Now they have like $80 sleep apnea shirts. You can buy one, but you can make it at home yourself. Okay, so yeah, training yourself just like pregnant women do. I used to be a stomach sleeper until I got pregnant, and then you can't, right? So you have to train yourself not to sleep on your back. The other thing you can do that's really helpful is get a body pillow or at least a king size pillow. And what that does is you're going to stack one hip on top of the other, put the pillow between your knees, and when you roll from side to side with your pillow. Try to avoid being on your back. You keep that pillow around your knees, and that can help you too. But if you have severe sleep apnea, that's not going to be enough. So don't be afraid, though. There's a lot of different treatments for sleep apnea now, and a PAP machine, positive airway pressure, is only one of the options. There's a surgical procedure that I won't get into today, but there's also oral appliances that some people with mild or moderate sleep apnea can use, so they don't have to always have a positive airway pressure machine. Yeah. So, and there's different styles of masks and 3 different types of positive airway pressure machines depending on your needs. So don't give up. There's lots of different options.
Just until you find a way that works. Yeah. Side sleeping is the best position?
Side sleeping is the best position. Right. Okay. And then let's see. Stopbang 3 or higher. Yeah, we got that. How do you help a child or an adult to sleep without? Okay. So if somebody has sleep apnea and they have a PAP machine, they make a chin strap to close your mouth. Okay. And you just have to ask your DME, your durable medical equipment supplier, and it attaches to your apparatus and closes your mouth. Other than that, if an adult or a child is sleeping with their mouth open, they need to have someone look in their nose because there might be a reason. And if they're a child, especially, they need someone to look at their adenoids. Okay, because it makes me feel like that person needs their mouth open to get extra air at night. Okay. Yeah. So that happened with my grandson, and he had to have his adenoids out, and he was 4. Okay, or 5, I guess. Right about that. So it's really important that not your primary care, but an ear, nose, and throat doctor look in there, because somebody that really knows how to find nasal polyps can spray your nose down, open it wide with the nose speculum and look back in there, take an x-ray or scope you and look to see if you have large adenoids, because adenoids are at the base of your tongue. So your traditional medical doctor, when you say, they can't see that.
Yeah.
Okay, so a great ear, nose, and throat evaluation to see what's going on there. And if it's happening during the day as well, it's probably allergies. Maybe they need to have an allergy test, or it's just a bad habit. So you kind of have to try to figure out what's causing it.
Yeah, and I have a lot of patients I refer out to ENT, and they fix them pretty well, to give them that sleep. We have another great question. Why is side sleeping the best position?
So it depends on from which direction you're looking at. So from a primary care standpoint, side sleeping is your best position because it's best for your back. Okay, so if you're going to sleep on your back and you're not having any sleeping problems like sleep apnea, you need to have a pillow underneath your back because it's really bad on your lumbar spine. When you sleep on your stomach, it's really bad for your cervical spine because you're pushing your neck over from one side to the other. So that's the primary care reason, okay? But from a sleep position with gravity, when you sleep on your back, that's what causes a lot of the narrowing of your airway, okay? So the stomach position, again, I never think anyone should sleep on their stomach because I think it's horrible for your back, your lumbar lordosis and all that. So, and then I never think anybody should sleep on their stomach. But as far as on their back, if you have sleep problems, especially sleep apnea, you should not be sleeping on your back. If you don't have sleep problems or sleep apnea, sleep on your back, but put that pillow underneath your knees.
Okay. If that makes sense. Knees. Okay.
Underneath your knees. Okay. Because that relaxes your lower back into the bed. But if they're snoring, don't do it unless you know you don't have apnea.
Gotcha. It's almost the opposite, right? Where you would want to be propped up, if anything. If you have trouble sleeping or breathing.
Oh, well, you're thinking of problems breathing at night, like dyspnea, like lung problems. Yes. But for sleep apnea, it doesn't
That's
matter. It's
okay.
just the gravity of everything going, oh, everything goes back. And then
Yeah,
your
it's more
airway
it's more
narrow.
Roy, then
Yeah.
so that okay. Yep, yep, yep. All
Yep.
right. So side sleeping is best. So let's talk about solutions. I like the questions, guys. Keep them coming. If you have any
Mhm.
questions, for sure. Let's talk about your solutions. Of course, we talk about diet a lot in this channel. Those who go on whole food plant-based diets are going to lose that weight very
Mhm.
fast.
Exactly. Yeah. He and I think alike. That's what we both do for that.
Yeah.
Yeah.
And then what about cognitive behavioral therapy? What's that?
And I'm going to go back to diet too. An anti-inflammatory diet is also good for insomnia.
Okay.
So when you're eating an anti-inflammatory diet, and obviously caffeine, if we're going to talk about diet, caffeine is a drug and it can last 12 hours. Most people don't realize that. It doesn't mean it lasts 12 hours for you, but for some people it can. So I
Wow.
have my patients do an experiment when they have insomnia, and we move the caffeine back 12 hours first and see how they're sleeping then. But
Hmm.
remember, a lot of people are saying, "Oh, I'm fine. I don't have my Pepsi after dinner." I'm like, "No, no, no, no."
12 hours.
Yeah, it can last 12 hours for sensitive people.
Okay.
Yeah.
Okay. So that'd be an easy fix for a lot of people, probably.
Yeah, sometimes that's a really easy fix, and especially with these energy drinks and the high doses of caffeine that people are intaking,
Mhm.
that part of it is cumulative. Like they've
Yeah.
had so much caffeine throughout the day that they're, "Wah." And some of
Yes.
those people might be hiding sleep apnea with the caffeine or hiding narcolepsy.
Hmm.
It might be self-medicating.
Self-medicating. Yep.
Yeah.
We have a question from Verona. Is snoring a form of sleep apnea?
You can snore and not have sleep apnea. You can have sleep apnea and not
No.
snore.
Yeah. You just
Yep.
said it.
But most people that have severe snoring probably have some sleep apnea.
Okay. If it's
Yeah.
severe, that's why you said it should be moderate to severe, not mild.
Yeah.
Uh,
If it's mild, we don't worry about it that much. It's
yeah.
possible you still have sleep apnea. Depends on the other symptoms.
But remember, we do have the Stopbang. 3 or more is a diagnosis that deserves further evaluation. With
Yes. Yes. Yes.
the Stopbang. All right, if you missed that, watch it again. But
Mhm.
quick Google search, you'll be able to find that.
Mhm.
Then we have a comment here from Audrey. My husband has sleep apnea and sleeps on his back and still snores. It's hard for him to sleep with him. Yeah.
Okay. So I'm wondering, oh, he does sleep with a machine.
Mhm.
Okay. So he needs to get off his back. So has he tried that? I don't know if you can still reply, but
Yeah.
he
Mhm.
should try to get off his back, because most sleep tests will show you. And so you can look at his sleep test. It'll tell you how many apneic events he had on his back. If
Yeah.
most of his events are happening on his back, then he needs to learn how to sleep another way. And
Mhm.
sadly, a lot of partners wind up sleeping in separate rooms when someone is a snorer and isn't willing to do anything about it.
Mhm.
So, has he seen ENT as well? There might be something else going on.
Okay. That's right.
You might have a nasal polyp or allergies or some other thing.
Mhm.
So, yeah, I'm sorry
Let's
for
say,
that.
yeah. So we have, like you said, there could be multiple reasons, right? Multiple causes. That's why I'm sure you value the behavioral therapy approach too. So can you talk to us a little bit about that?
Sure, sure. So when I do my initial intake, that 2-hour appointment, my sleep intake is very detailed. So, for example, I want to know what your average bedtime is, not what time you're asleep, but what time you get in the bed. I
Okay.
want to know your sleep onset. In other words, how many minutes it takes for you to fall asleep.
Hmm.
I want to know approximately how many times you wake up, and I want to know how many minutes it takes for you to go back to sleep. And then the next part of sleep is I want to know what time you get up, and is there an alarm involved or not? So does your alarm wake you at this time and you rise at that time? So I take all that information into account. And
Okay.
that is the first thing you do to diagnose insomnia. In other words, do you have sleep onset insomnia, means it takes more than 30 minutes to fall asleep? Do you have sleep maintenance insomnia, which means altogether you're awake for more than 30 minutes at night? Or do you have mix, both? So
Mhm.
that's the first thing, is to diagnose your insomnia. Do you have it? Do you not have it? What type do you have and how bad is it? Does that
Okay.
make sense?
Yeah, makes sense. Yeah.
And this is after I've already screened them for sleep apnea. I've already screened them for narcolepsy.
You've
I've
done the
already
blood
done the
work,
medication history
deficiencies.
to see if medications are the problem, and
Mhm.
the diet history. So we've already talked about caffeine. With the medication history, for example, and a lot of people don't realize this, but many of the medications that people take cause insomnia, right? And many people take medications that don't cause insomnia, but they take them incorrectly. So for example, if you have reflux, you should be taking your PPI medication before bed, because guess what? Reflux gets worse with gravity. But most people are taking it in the morning.
Yeah.
Okay, and if you're taking a statin and you take it before bed, that can keep you awake. You should be taking that in the morning. So sometimes all I do is rearrange medications, right? Or I take caffeine away. Okay. The next thing I do is I ask a lot of questions to figure out what their circadian rhythm is like. Are they a morning person or are they a night person naturally? Once I figure that part out, sometimes that explains why they have sleep onset insomnia. It's not a true sleep onset insomnia. They're just a night owl and they're going to bed too early, or they're not doing the right things to prepare their circadian rhythm for bed. So we can retrain them. So we look at their schedule. So that's why I ask so many questions. What time do you have to be at work? What do you do for a living? Are there options with that? If you're in the military and you have to be to work at 5 o'clock, they don't care if you're a night owl. We better figure this out, right? So then we train their circadian rhythm so they can get sleepy earlier. And then I do things in the morning that will wake them up. Okay. So, it just depends. Everybody's a little bit different, but understanding the circadian rhythm, do they or do they not possibly have sleep apnea, which definitely affects my sleep therapy. There's certain things I can't do to increase their sleep pressure until they have treated sleep apnea. Okay. And then understand their sleep hygiene. All right. So did you mention someone said they sleep with the TV on, right?
Radio on.
Okay.
The mute, sound. Yeah.
Yeah. You should have a consistent sound at night. Okay. So for example, if you listen to ocean sounds, it should stay on all night. If you have a fan on, it should stay on all night. I don't know if you've ever had, lost power in the middle of the night and you're used to sleeping with a white noise machine. When that thing goes off, you wake up right away. Right? So whatever it is, it should be consistent. But this is what's bad with most music. That's not the case. The volume goes up, the volume goes down, the song changes, somebody talks, right? So if you're listening to something like, let's say it's jazz music and it's the same all night and there's no commercials, I'm okay with that. But that's not how it usually is. And also every time there are words, your brain is trying to figure that out. So it should be music without words, preferably. Okay. Because that's something your brain is still listening to and trying to understand and absorb. So that's more work for your brain. So I like a consistent noise, like a white noise. And some of my patients use music, but I try to get them to do jazz or classical without any words. Yeah. And it stays on all night because people want to do timers. No timers. It's either on or it's off. Okay. Because then when you wake up, your brain is used to falling asleep with it. So now your brain is like, but that thing that usually happens when I fall asleep, it's not here now.
Yeah. Okay.
Right. So there has to be consistency to that. Now, TV is never a good idea. Why? Because what happens with the TV is that blinking screen. Yeah. Okay. Even when our eyes are closed, close your eyes right now. Your eyelids are see-through. Your brain always knows if the light is on or not. Okay. Yeah. So those blinking lights are turning our melatonin off. Any type of light in your room is turning off the melatonin. So you need a pitch black bedroom. Okay. So I'm that crazy person that travels with like duct tape and all kinds of stuff. And I'm like, I take pillows and shove them under the hotel doors and a light from the hall. Like, I drive my husband crazy. He's like, you have lost it. But I mean, I have insomnia and I have to do these things myself.
You value your sleep.
Yep. So I totally understand it.
Is there a time frame then for when you should shut off the TV and the cell phones and tablets, things like that?
Yeah. Some people call it the 3-2-1 rule. Okay. So 3 hours before you go to bed, no food. 2 hours before bed, no liquids. 1 hour before bed, no TV or bright lights or, even the fluorescent lights. Okay.
3-2-1.
3-2-1. But everybody's different. So I tell all my patients the same thing. You are your own experiment. So we're going to try 1 or 2 things at a time. Do this for a few nights. If this doesn't seem to affect you negatively or positively, then have that thing, right? So I'm a perfect example. I tell many of my patients, you're going to create a nest. A nest is a place that you go to relax. And you stay there until you're sleepy, which means you can't keep your eyes open anymore. Then you crawl into your bed. Your bed should only be for sleep or sex, and that is it. And any of the other things confuses your brain. But I nest in my bed because it works for me. And I've tried it both ways. So when I say nest, like the hour before bed, I can read in my bed and fall right asleep. Okay, some of my patients can't. Some of my patients have to get out of the bed, go nest in their living room, and then go to the bed sleepy. So that each piece of the therapy is an experiment. You're going to try it on yourself, and then you're going to know whether or not it works. And I tell people, try to do all of it initially and get some darn sleep. And then we can start adding things back. Yes. The most important thing, if you can do that, some people are not all or none people like me. So they can't, but if you can do that, it's going to work and you're going to get sleep. But if you can't, then you're going to try one thing at a time, give it a few days and see what things work for you.
Very, very, very good advice. And I like that concept of nesting, having a place where you can nest.
Mm-hmm. Yep.
I've always heard that don't only use your bed for sleep, right? You don't using it. So which, obviously if you have a TV in your room, you probably want to take it out, if you
right. I'm not a fan of TVs. If you're using the TV in the morning to watch the news or something and your brain knows it's daytime, I think that's fine.
Yeah, that's what I do.
Or if you don't have insomnia. Some people don't. My husband doesn't. He could watch TV every night before bed and scream and yell at football, whatever. I can't do that.
He's out.
Yeah. But I use my Nest at night to not disturb him. So if I wake up at night, which usually only happens if I'm stressed or worried about something, but if I wake up at night and I can't go back to sleep, I'm not going to turn the light on and do a lot of things in the bedroom. So I'll gather my bathrobe, my book, and my dog, because my dog will keep him awake. Grab all three and I go to my Nest. So my Nest is just my comfortable place on the couch, and I read until my eyes get heavy, and then I go back to bed. Now that works 99% of the time for most people, but there's something that can happen called the switch, which means as soon as you get back to bed, you're wide awake again. If that happens, I tell my patients, treat yourself like you would a toddler. Be kind, but be firm. In other words, you say, no, 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 you're not allowed to worry in bed. You're going to go back to the couch and read again. And then you give yourself positive self-talk. Yay, I wanted to read the next chapter of my book anyway. And I'm going to be fine tomorrow because I always am.
Yes. And then I guess I like to read with my phone, a Kindle app. Mm-hmm. Not a good idea, right?
Nope. Yeah, when I say your Nest has no electronics and no food and very dim lights. So if there are overhead lights, you don't turn those on. You turn a little lamp on, keep a basket of things to do. Some people do adult coloring books, crochet or knitting, reading a book magazine, but none of them involve electronics because you don't want to turn off your melatonin.
Melatonin,
yeah.
Yep. You answered some of these questions probably, but so Jasmine's asking, listening to YouTube videos at night is not optimal. Obviously.
Well, the problem with YouTube is it's pretty hard not to look at them.
Yeah.
And then you've got the blinking lights and you've got the phone. I don't recommend phones at all, if at all possible. Mm-hmm. People don't remember this, but they still make old-fashioned alarm clocks. Can you imagine?
Right. Yeah.
Yeah. So, it depends. Again, we're back to experiments. Everybody's different. Some people can use their phone as an alarm clock.
No problem, then go ahead. But if it's a problem, why not try to
Yeah. If you're addicted to that thing and you've got to scroll, then you got to get off that thing. Yeah. If you can use it as an alarm clock and turn it off and put it face down so it's not making any glowing light in your room, you're fine.
Yeah. Someone says, Audrey says, jazz, I love jazz. I have problems staying asleep. I take trazodone. That's actually something we should probably
let's talk about that. So yes, I used to prescribe trazodone all the time when I did psychiatry, so I understand. But your goal with sleeping medicine is to get off your sleeping medicine, because the newest studies are showing that it's not good for your brain. So our brain is like our self-cleaning ovens. It does a lot of work at night. You actually have channels in your brain, kind of like your lymph system has channels, and they need to be cleaned. Yeah. And so when you artificially force yourself to sleep with medication, the studies show that your brain isn't doing as well at the cleaning part, and that might increase your risk for dementia. So part of my goal in life is to get people off trazodone and Ambien and even Benadryl, get off everything and learn how to sleep. So if you're in the North Carolina area, find me. If you're not, find a cognitive behavioral therapist for insomnia, not a straight up therapist, not for anything else, just insomnia, because it's 80% effective in 4 appointments. So, it might take 6 if you're on a higher dose of trazodone, but most people okay, so I was going to read you.
Yeah, I was just going to tell you, give us some testimonies to let us know.
This is a good one for her, because this is a very similar situation. Noah was a 26-year-old that I saw 6 times in 2022. So I saw him 6 times. Interestingly, he's a psychologist, but like most psychologists, had never been trained in cognitive behavioral therapy for insomnia. In my area, I'm the only one that I know of with that certification. So you might have to find someone online, but you can find it. He presented with the following complaint. He's 26 years old. I've been having problems sleeping for 10 years. I've been on Lunesta, which is a hypnotic like Ambien, for 2 to 3 years. I've also tried melatonin, Ambien, trazodone, and as-needed Benadryl. I don't want to be on Lunesta because I have blackouts 30 minutes after I take it, and I also have really low energy level. He was taking Lunesta before bed, and he was trying to go to bed between 11 and 12, but he wasn't drowsy then. And when he was going to bed, he was on his phone. On Lunesta, it was taking 30 minutes to fall asleep, but when he didn't take it, it was taking hours. He had anxiety when he couldn't sleep about not getting enough sleep. Work was going to be the worst day ever, right? We've all had those thoughts. And he was waking up once or twice a night, but he would go back to sleep. So that wasn't the problem. His problem was falling asleep, not staying asleep. He was waking up without an alarm clock, but he was tired and wired, and his energy level was like 5 or 6 all day long on a 0 to 10 scale, which is too low for a 26-year-old, right? Most waking hours, he was on a screen 24/7, and he was almost never going outside, okay? He was getting a little bit of exercise because he took 2 hours of martial arts a week, but other than that, he was extremely sedentary. He preferred to sleep 12 a.m. to 8 a.m., which means he probably has a slightly delayed circadian rhythm. He's a little bit later than most people that want to sleep somewhere between like 10 and 6, so a little bit later. He was drinking 24 ounces of caffeine a day, and he would stop it at 1 o'clock. But remember what I said about caffeine can last 12 hours, okay? He was also drinking alcohol from 8 to 9 o'clock at night, maybe 1 or 2 beers. But alcohol helps you fall asleep, but it destroys your sleep cycle, so it gives you really junky sleep, poor quality sleep. He was eating at 9 o'clock at night, which was a little bit late. And his vitamin D levels, which we haven't even talked about this, but I do blood work as well. When your vitamin D levels below 60, it's really hard to get good quality sleep. So he was a psychologist, so he was super motivated. He did everything I asked him to do. I treated his vitamin D deficiency. We worked on moving his circadian rhythm down back a little bit. We took him off the caffeine, all the things I've talked about. And by appointment 4, we were already weaning him off his medication. By appointment 6, he was completely off of it, falling and staying asleep with ease, reporting improved energy and focus during the day. His diet and exercise were also improving, and he was getting less screen time and finally some sun exposure. And this was his testimony. After 10 years of being medicated for sleep, I'm happy to report that my body has learned to sleep naturally and restfully. All it took was a few weeks worth of sessions to intuitively teach myself to fall asleep the way I was always meant to. Nice. So you can get off the trazodone. You just have to have somebody like me pick your sleep apart, make sure there's nothing big or wrong with it, like sleep apnea or something like that. Maybe check some labs, maybe not. Maybe, who knows, there may be an ear, nose, and throat referral, an allergist referral, a psychology referral, but it's all fixable. But I would avoid taking trazodone long-term. It's not good for your brain.
A lot of people. And I think we probably, next time we talk, we need to talk more about all these sleep aid medications and the risks that come with them that many of our physicians are not covering. But yeah.
Well, they don't have time.
Yeah.
So if your average doctor has 7 to 15 minutes and the average patient has 6.5 questions, which is true, then how are they going to have enough time to talk about all that?
Yeah, the last thing you think about, okay, well, there are side effects, and you got to turn on the commercial voice, so and cover them very fast.
Yeah, yeah. And they expect the pharmacist to cover it, but most patients check the box and say, I don't want to talk about it. Well, don't go off the trazodone cold turkey. I don't know your dose. Yeah. You might need to wean off of it. That may not be safe for you, and you don't have the tools in your toolbox. So I'm giving you some very bare bones ways to get off of it, but everything I should be taking, this is not medical advice. This is a suggestion. Never go off medication abruptly.
We always want to give the disclaimer in these lives. Any information you get, discuss with your doctor, right? Discuss with your physician before making any changes to your medications.
Yeah. Some medications can't be stopped abruptly, and you'll feel horrible. Okay. And in fact, did you notice what happened with Adam, my patient I just read to you? We didn't try to stop his medicine until I taught him how to sleep. Then we weaned off his medicine.
Problem first. So.
Yep, because otherwise you're going to be like, wow, the lady's crazy. I feel horrible.
Yeah.
Same. Okay. Right. So, no, it's not a horrible dose, but you have to be trained first to get off of it. Once you're confident that you can sleep, then it's easy to get off the medicine. That's not the hard part.
Yeah.
But you haven't been taught.
Yep. Changing.
And you might only need one appointment. I've had some patients have one appointment, call me and go, I'm done, I'm perfect, everything's great. Yay.
Yeah. Same with our consultations. I have people call me and like, yeah, they don't even need a coaching for the whole program. They just need one appointment.
Right?
And
I mean, sometimes that's all it is. It's
that's
crazy.
what I love about holistic approach of medicine. And I guess we can close on this before we tell people about how to reach you. Is that the solutions are simple. It's
Right.
not complicated. It's simple, and often free.
Mhm.
And I believe firmly that's how God wants it to be. That's how we are created. So let us know how we can. Or let me actually turn everyone to this QR code. What they can find on your website in order to find out how to work with you, learn from you.
Mhm. Okay. Well, today, if anybody lives in North Carolina, I offer a 10-minute free appointment. So that free appointment can be talking about what services I offer, how I can help you, or I do screening for antioxidants. So I have kind of a hand screener. Now, this thing doesn't look like much, but it costs more than my car. I rent it, which actually screens for your antioxidant levels. So we can talk about your nutrition that way. But that's what I offer. But I take most insurances. So I'm under primary care under most insurances. So I could take United or Medicare, or Blue Cross or TRICARE. There's a few I'm still working on getting. The only one I'm not taking is Medicaid for sure. Okay, so I take most insurances. So you can make a new patient appointment there. You can ask for a free 10-minute appointment. It could be in person or it could be a telehealth appointment, but it has to be the state of North Carolina because that's the only place I have a license.
License, yeah. So
Yep.
so scan the QR code
Mhm.
and look through, skim through the website and book a consultation, 10-minute consultation. I think I want to check out the antioxidant machine. That's kind of cool. I want to see
Yeah. You need
my
to come to Fayetteville. I'll scan
coming.
you.
I'm coming, girl. I'm on my way. Yeah,
Yeah.
I'll hit you up. I'll hit you up.
Yeah, it's
That's
cool. I mean, I
cool.
use it you should get one. I motivate my patients with that all the time, especially
Yeah.
kids, because it's like a game. They want to get their number up.
Yeah, that's right. That's
Mhm.
awesome. So, Miss Laurie Powers, we learned some awesome things from you tonight. I'm sure many people might still have questions, and I'll try to reach out to you if anyone
Mhm.
does ask me about your services. But the QR code is there for you guys. Follow up with the sleep apnea specialist, Laurie Powers.
Mhm.
Specializes also in culinary nutrition. She's gonna get your life right.
Woo!
All right.
Thank
So
you.
I always like to close off by saying, beloved, I pray above all things that you may prosper and be in good health, even as your soul prospers, and get some good sleep. All right.